that a modest reduction in unnecessary or inappropriate prescribing would have major benefits. So basically, we can get much better health outcomes by having fewer antibiotics.
Yeah, that's true. Antibiotics are some of the best medications that we have available to us. They've gotten us through a period of time where infections killed millions of people worldwide and still do. Unfortunately, though, the overuse of anything good is bad. And antibiotics have become that sort of go-to drug, even in situations where it's a tough call. Doctors sometimes will overuse these drugs in situations where patients might have an infectious disease or something else, maybe not following through their entire workup of the patient to make sure that the patient does have an infection, instead treating them empirically with antibiotics. Now, the problem, as you said, is that when you overtreat with antibiotics, what you can do is select out bacteria that themselves are resistant to the antibiotics in the future.
Right, those superbugs that we've often heard about. But this study from the CDC, one of the most striking things about it, found that some hospitals, this is not just individual doctors, just doctors at whole hospitals prescribe antibiotics 3 times more often than some at other hospitals. How can that discrepancy, it just makes no sense statistically, so how does it happen?
Well, it speaks to a couple of things. Number one, there's different cultures at different hospitals. And as the culture in one hospital might gear towards just treating empirically with antibiotics before an infection has been confirmed, that tends to pick up, and that becomes the culture of the hospital, the way people are trained, etc. The other issue also that we need to consider is that some hospitals are more likely to treat patients that may have infectious diseases. So part of that is necessary, but most of that, like you said, is very likely just a matter of culture.
And the CDC's